Hello dear viewers, welcome back to my channel. Today we're going to talk about a very important topic, viral infections in newborns. This is something that every parent, caregiver, and health professional should know about, because it can have serious consequences for the baby's health and well-being. So, what are viral infections in newborns? They are infections caused by viruses, which are tiny organisms that can invade and multiply inside the cells of the body. There are many types of viruses that can affect newborns, such as herpes simplex, HIV, cytomegalovirus, and hepatitis B. These viruses can be transmitted from the mother to the baby during pregnancy, birth, or breastfeeding, or from contact with other infected people or objects. Now, you might be wondering, why are viral infections so dangerous for newborns? The answer is that newborns have a weaker immune system than older children and adults, which means they have less ability to fight off infections. Also, when a newborn gets an infection, the illness is often more severe than when an adult or older child gets the same infection. For example, a common cold in an adult might cause a mild fever and runny nose. In a newborn, it could lead to pneumonia and breathing difficulties. And that's not all. When a newborn gets a fever, which is a sign of infection, it could indicate a life-threatening condition. That's why doctors recommend that any newborn with a fever of 100.4 degree, 38 degree, or higher should receive immediate medical attention, even if the baby seems fine otherwise. A fever in a newborn could be caused by a serious infection, such as meningitis, sepsis, or encephalitis, which are inflammation of the brain, blood, or spinal cord. These infections can cause permanent damage or death if not treated quickly. So, how can you tell if your newborn has a viral infection? Well, some of the common symptoms are fever, rash, blisters, jaundice, poor feeding, lethargy, irritability, seizures, breathing problems, bleeding. Of course, these symptoms can vary depending on the type and severity of the virus. Some viral infections can cause no symptoms at all, or only mild ones, while others can cause serious complications, such as brain damage, organ failure, blindness, deafness, or death. Therefore, it is very important to seek medical attention as soon as possible if your newborn shows any signs of a viral infection. The doctor will examine the baby and do some tests to confirm the diagnosis and rule out other causes of illness. The treatment will depend on the specific virus and the condition of the baby. Some of the possible treatments are antiviral drugs, fluids, oxygen, blood transfusions, or surgery. But is there anything you can do to prevent viral infections in newborns? Yes, there are some preventive measures that you can take, such as pregnant women should get tested for viral infections and receive appropriate treatment if needed. Pregnant women should avoid contact with people who have viral infections or symptoms and practice good hygiene. Newborns should receive immunizations against some of the preventable viral diseases, such as hepatitis B and rotavirus. Breastfeeding can provide some protection against viral infections, unless the mother is infected with HIV or herpes simplex. Newborns should be kept away from crowded places and people who are sick, and their caregivers should wash their hands before touching them. These are some of the ways that you can protect your newborn from viral infections. Remember, viral infections in newborns are not something to be taken lightly. They can have serious consequences for the baby's health and well-being. So, be alert, be informed, and be proactive. I hope you found this video helpful and informative. If you did, please give it a thumbs up and subscribe to my channel for more videos like this. And if you have any questions or comments, feel free to leave them below. I'll see you in the next video. Bye for now.